Hi, welcome to Heal Body, Mind and Spirit. My name is Dermot Farrell and today we're going to talk about herbal remedies. Why take herbal remedies? Well, herbal remedies have an awful lot of benefits, and really if you use them in line with regular allopathic medications, you'll be surprised how good the results can be and how few the side effects can be. Okay, why use herbal remedies when we can use allopathic medications instead? And the real reason for using herbal remedies is that they've been around for thousands of years and treated many patients. Allopathic medications have really taken off in the last 70 or 80 years, especially with the advent of antibacterial medications. And antibiotics really are profound and powerful medications. And I want to get something straight here from the start. I'm not anti-allopathic medications. I think they have their place. Bacterial medication, for example, has saved millions and millions of lives and extended the average life expectancy of the average person on this planet today. Western medication, allopathic medication, is also very good at treating things like surgical interventions like heart operations, liver, kidney operations, major surgeries for people who've had traffic accidents and so on. So in many ways it's very useful as a first line of defence. But its track record for treating chronic disease is not very good. And I feel the reason for this is that there's too much of a focus on symptoms. So much so that when you go to your doctor, you might have an ache in your stomach, he gives you one drug. You have an ache in your side, he gives you another drug. You've got an inability to sleep, he gives you another drug. Rather than taking an older approach, or an old age approach, of thinking, well, maybe the pain in the side, the pain in the stomach, and the inability to sleep, maybe they're telling us something bigger and we should treat the whole patient. So this is where herbal remedies can be very useful. It gives us another alternative, and I like to think of herbal remedies as a resource. I also like to think of allopathic medication as a resource. So we're thinking of treating versus curing. There's very few medications that cure patients. So usually if you're taking, say, antihypertensive medication for high blood pressure, it's not curing your blood pressure, it's just treating it. You take an anti-diabetic medication, it's not curing your diabetes, it's treating it. So by and large, Western medications don't cure that much, they treat a lot of things. Now, also to clarify, a lot of herbal remedies are the same. Some herbal remedies do have a curative effect, but again, many of them don't. So let's get their head around that first of all. By and large, whether we're using drugs or using herbs, we're treating the condition, we're not necessarily curing it. How do we cure the condition? Well, sometimes there's no cure, but often the cure lies in rebalancing our lives and rebalancing our health. And usually we have to make a lot of changes. We might have to go to a regular doctor, we might have to go to a specialist, we might have to go to a complementary therapist, we might have to go to the gym or do some kind of exercises. We might have to make changes in our life, and we might have to use drugs, and we might have to use herbs. So I see them all as the many different things that you usually have to do to treat a condition, to cure a condition. And pretty much every condition can either be cured or radically reduced. But the mainstay, the things which are helping us with our symptoms on a daily basis, are either allopathic medications or herbs. I do feel that the herbs have some distinct advantages. So what advantages do the herbs have? Well, first of all, the advantage of the herbs is that they're much more gentle in their action than the allopathic medications. So for example, if you've got high blood pressure, there's various ways that an antihypertensive drug can use. But one of the ways it works, one of the options available, is to make the tissues in the arteries more flexible, and that makes the arteries less stiff and reduce the blood pressure. But the problem with something like that is it also reduces the elasticity or the rigidity, should I say, of different tissues around the body, and something like that will often reduce in water retention, maybe in the legs, for example. So what the allopathic medication are doing is they're reducing something and then it causes a problem somewhere else. So this can often be a problem with allopathic medications. They're working on the symptom, they're not working on something else. Whereas often with the herbs, they have a much milder effect. So you usually get far fewer side effects of the herbs. The second advantage of the herbs is often they are atonic, and sometimes they will actually cure you, but many times will add something to you. Now usually allopathic medication is very powerful and very strong and a little bit toxic, and usually they result in side effects, and they usually take something from you rather than add something. Now that doesn't mean that all allopathic medications are bad. I'm not going to hop on the all medications are bad bandwagon. I do think they have their place, but we have to ask ourselves questions. If a person's on drugs for years and years, what's the side effect of that drug? Especially if you give people a lot of drugs, what are the side effects? And many times when people are on a lot of drugs, there's many interactions. I remember my father, for example, towards the end of his life, he had a lot of health problems, and about 20 different allopathic medications per day. And we were going to a meeting as doctors, and we're all kind of pulling our hair out trying to work out why he went on one drug 10 years ago, another drug 5 years ago. And this is something that I'd say to anybody, first of all, if you're on a lot of drugs, keep talking to your doctors, because often one doctor will prescribe something and then you're on that for life basically, then another doctor prescribes something else the next year and so on. And often you have side effects, and I think my father definitely got a lot of side effects. And if you take a look at allopathic medications and that little kind of information sheet, you often see a lot of terrible side effects. And if you're left on a bunch of drugs for years and years, often some very toxic effects and literally organic damage can actually occur over a period of years. I'm not saying this to scare you or frighten you. I'm just saying that, more responsibility is required in this area, and usually you have to take responsibility. Often if you have a chronic condition, the doctor will look quickly over the previous notes, but he usually or she usually isn't that tuned into it. You have to make a point of that. So that's an advantage again. Usually the side effects are less, and usually they have a tonic-like effect. Final advantage which I feel that herbs have is that, okay, you might try and reduce the allopathic medication, and often you can swap out the allopathic medication for herbs and a lot less side effects. But sometimes it's not possible. However, you can always reduce the amount of allopathic medication, and it's a good thing if you can reduce the allopathic medication, because obviously you're going to reduce the potential side effects and interactions. So those three things again, they're more gentle on the system, they have fewer side effects, they have a tonic-like effect, and even if you can't get off the allopathic drugs, maybe you can reduce them, which is a very good benefit. So we looked at the advantages of herbs. What are the disadvantages of herbs? Well, the first disadvantage of herbs is that they are slow to work. So don't take a herb and expect to be cured tomorrow. You can take, for example, again, our hypertensive example, you could have blood pressure today, take a hypertensive and be fine in a few hours. But if you take a herb for high blood pressure, it might take a week or a week and a half or 2 weeks to work. So that's the thing I'd say, for acute treatment, you got a big problem, say you got a migraine, for example, you want to cure that migraine now, then take your migraine tablet now, because whatever herb that you might use might take weeks to work. That doesn't mean that the herb shouldn't be used, but they're used more for chronic treatment rather than acute, because they're slow to work. Also, they're pretty slow to leave your system as well. That's another factor. Another disadvantage of herbs is that they are weaker. Now, there's an advantage that they're weaker in that they're more gentle. There's also a disadvantage that they're weaker. So usually, you have to take quite a bit of them, and often you might have to take several. So, for example, we give again our hypertensive patient, maybe they need 2 or 3 herbs to have the same effect as taking one allopathic medication. It depends. Some of them are strong. So if the herb is a weaker herb, you're going to have to take more of it and maybe use several herbs together. So you have to have a different approach than allopathic medication. A final consideration regarding herbs is that when you're using herbs, realize that some herbs are very strong, because people have a tendency to think it's only a herb, and they go online, they buy some kind of herb, and they start throwing it in there. And some herbs are very strong. Some herbs are as strong as allopathic medications. Some herbs can completely replace allopathic medications, and literally they are an allopathic medication except that they're made naturally. So do realize that if a herb is very powerful, this is an amazing herb, I got an amazing result, chances are that that herb is probably as strong as an allopathic medication, and chances are that it has side effects and toxicity problems. So before you start using any herbs, you should Google the contraindications, okay? I also have a book coming out, which I might have linked below when it's coming live next few days, on herbal remedies. So you'll see a lot of useful information in there as well. But the key thing is to realize that if the herb is weak, you're going to need a lot of it and maybe a few herbs. If the herb is strong, you might be literally able to just swap over the allopathic medication for this herb, but check the contraindications because some of them are pretty strong and they literally are as strong as medication. Is that something just to be aware of? Okay, let's just check my sheet here in case I've missed anything out here. Yeah, treatment plan. Okay, so what I'm saying so far with herbs is that they have a place. See them as a resource. Try out a few herbs and see if you can maybe reduce your allopathic medication or maybe even stop your allopathic medication altogether. But treatment plan is really the most important thing here. And what I mean by treatment plan is that we must have a plan of action in order to treat a person. Now sadly, in allopathic medication, a plan of action is usually giving you a bunch of drugs and say stay in there for the rest of your life, which isn't much of a plan. Other than go to the gym, lose weight, do some exercise, which is good advice. Now I would also say go lose some weight, go to the gym, etc. But I'd also say that maybe go to the complementary therapist, the acupuncturist, the Ayurvedic doctor, the homeopath, the naturopath, maybe somebody like that. Maybe take up a yoga class or a Tai Chi class. Maybe read some books on positive thinking and how to take charge of your life. Because, you're a human being. This channel is called Heal Body, Mind and Soul. And that's because those three things are connected. The body, the mind and the soul are connected. So that's my big thing I'd say. I'm a big fan of herbs. I would say use herbs and try and get off the allopathic medications. But even herbs are just another resource. Try and rebalance your life, and that's a very, very vital thing. And also taking responsibility. The final thing here as well, take responsibility. In general, when you go to your allopathic clinic, your hospital or your medical center, it's almost like you are, these days, well this is how I feel, most people feel, it's like the doctor or the nurse or whoever they are, they're the authority figure and you're like a little boy or a little girl in school and you have to do what they tell you to do or you're bold or naughty. And some of them will either chide you as if you're bold or naughty. You didn't take your medications. Many times I've been to hospitals and visited people in hospitals and I'm quite amazed at the nurses kind of giving out to the patients like the little kids. You are in control and you are responsible. So whenever you're talking to a doctor, realize that it's your responsibility. So you have a couple of options. You can either be patient, as in be a patient, as in sit there patiently and hope that they know what's good for you, or you can take charge. Now what I mean by taking charge, I'm not saying that you should just treat yourself and ignore the doctors. I'm a big believer in listening to the doctors and taking their advice, but also being open-minded, reading books, reading articles, talking to other people, trying different things, because usually they'll give you one option and they kind of presume you're going to take that option. That option isn't necessarily what you want to take. I remember some years ago I was listening to a radio interview where the radio interviewer was interviewing a doctor who was doing eye operations. I saw a radio interview where a doctor was doing vasectomy operations. There's another one I'll tell you about in a minute. But the vasectomy doctor was basically saying there's very few side effects. Vasectomy is basically where you tie the vas deferens and the testicles don't produce semen anymore for men who want to have sex but don't want to produce kids. He says it's a very safe operation, but some small percentage will have a burning sensation in their testicles for the rest of their life. And the way he said it was like it was nothing. And I was thinking, well, what if I'm the one who has that operation? I have a burning sensation like my testicles are on fire for the rest of my life. So this is the problem with doctors. I'll give you another example is watching a TV interview where a doctor was talking about the operation for people with short-sightedness, whereby you get the operation, the laser treatment on the eye. And he says for the vast majority of patients it's fine, but there's the odd patient now and again who has this sensation of sand in their eye for the rest of their life. And again I was thinking, well, how would I like to be the patient who's got sand in my eye for the rest of my life? Now I don't say anything against vasectomies, I'm not saying anything against getting that operation to cure short-sightedness. But what I am saying is that surgeons in particular are prone to throwing out very negative side effects as if they're an afterthought, because ultimately they come from a school of training which is saying, we know what you need. I've been to medical college for 5 or 6 years, plus I did a PG and another PG. I've got 10, 15 years of training, 30 years of experience, and they tend to feel that they know, and it's true, they do know, but often very few of them are kind of empathetic and think about that the person they're talking to knows nothing about the side effects. and that they'll waltz you into a treatment plan that might be very destructive for your health without thinking about it. Now, I'm not saying that they're being negative here. I'm not criticizing doctors in case any doctors are watching this, but I'm simply saying that you as a patient, you have to think about what you're entering into with any kind of treatment plan, whether it's a complementary therapy or whether it's a allopathic medication. And just be careful and make sure that you do your research and you're fully aware of all the various possibilities. Okay, because often they will have long-term side effects. Now, we shouldn't scare ourselves either. You can get a simple like headache pill and look at the side effects, and just people go into organ failure on taking minimum dose of headache pill. So let's not scare ourselves about allopathic medication. But I'm simply saying you are responsible. So just to sum up this video, why use herbal remedies? I think use them because they have fewer side effects and they have a tonifying effect on your body. And even if you can't get rid of the allopathic medications, you can use the herbs to reduce the allopathic medications, which will usually reduce your other symptoms. On top of that, I would say try and take a holistic approach to your health rather than a symptomatic approach to your health. Become a kind of armchair investigator and be responsible, because ultimately these people are treating so much or so many people with terrible problems, and they mightn't think much about your stomach ache, but you think a lot about your stomach ache. You're the one living with it, okay? So be responsible. So I hope you liked that video. I have a few more in this series on herbs coming out over the next couple of days. And like and subscribe and have a great day. And thanks for coming by.